Hello everyone, welcome back to my channel. My name is Pinky. I'm an advanced pharmacist clinical practitioner. Today I'm going to discuss about vaginal thrush. It's a very common condition in women. Vaginal thrush is caused by a fungus infection. In our vagina, there are naturally growing fungus, right? But however, when the natural balance of the vagina is upset, the pH, there is an environment in the vagina, right? And when this environment gets upset, the fungus multiplies and can cause vaginal thrush. So we are going to discuss about the symptoms, we're going to discuss about the treatment. So basically this kind of fungal infection, it develops in like warm, moist, earless parts of the body, and this is why the vagina is the most common site for this infection. Other areas of the body that are prone to this kind of infection include like groin, mouth, nappy area in babies. Vaginal thrush, it does not damage the uterus, it does not damage the vagina, okay? And if you're pregnant, vaginal thrush does not affect or harm the baby. So what increases increases chance of having vaginal thrush? So the chances are increased like if you have had a recent course of antibiotics, pregnancy, diabetes can be a reason, and a weakened immune system. And what are the symptoms of vaginal thrush? The symptoms of vaginal thrush. So the classical symptoms of vaginal thrush is itchiness, soreness around the entrance of the vagina, pain during having sexual intercourse, a stinging sensation like when you wanna wee or urinate. There can be vaginal discharge. The vaginal discharge is not necessary that it's always going to be present. The discharge is usually odorless, thin, watery, and sometimes it can be thick as well. Thick and white like cottage cheese. So vaginal thrush can be treated by tablets, creams, pessaries, which you can buy over the counter from any pharmacy. Pessaries and oral tablets are equally effective, okay? Now, for the tablets, the tablet is called Fluconazole, 150 milligram, just one dose. Fluconazole, 150 milligram, one dose. If it is recurrent vaginal thrush, then Fluconazole 150 milligram every 72 hours for 3 doses, then 150 milligram of Fluconazole once weekly for 6 months. Please do read the patient information leaflet before you take any medication. It's very important. So fluconazole is an antifungal tablet, okay, and it should not be used like if you're pregnant or breastfeeding, okay. Now let's talk about anti-thrush pressures. Pessaries are it's a especially shaped medication which you insert into the vagina by using an applicator, like similar way as you use like a tampon, like the same way that like how a tampon is inserted. And there are several strengths of pessaries available over the counter from a pharmacy, and the name of the pessary is clotrimazole pessary. Clotrimazole is an antifungal medication and the brand name is Canesten, okay. And there are creams as well known as clotrimazole 1% cream, which treats fungus. So the clotrimazole 1% cream, it treats the fungus, like it kills the fungus around the entrance of the vaginal area, okay. So I'm also going to give you some tips which you can apply to help yourself to relieve the symptoms. So like avoid wearing tight fitting clothing, avoid wearing undergarments made of like synthetic materials, loose fitting cotton underwear may be used. Okay, avoid perfumed products around the vaginal area, such as like soaps, shower gels, as this may increase further irritation. Now, we're going to discuss about like when to contact your clinician. If it is the first time you're having thrush, if you're under 16 or over the age of 60, if you're pregnant or maybe pregnant, if you're breastfeeding, you have abnormal menstrual bleeding or blood stained discharge, you have lower abdominal pain, okay, pain in your lower tummy, if you have like red swollen vagina or vulva or cracked skin around the entrance of the vagina, if the symptoms are different from the previous symptoms, it's quite different, and if the discharge is different in color, bad smell, you have to contact your clinician. Okay, and if you have sores in the surrounding area, this is rare but indicate the presence of another condition such as like herpes simplex virus. So there can be other things which I really need to discuss about like when to contact your clinician. That is like if you have like 2 cases of vaginal thrush in the past 6 months, if you or your partner previously had like sexually transmitted disease, or if you believe that it has come back, and if you like react badly to a antifungal medication like clotrimazole, fluconazole, if your symptoms do not improve within 7 to 14 days, or if you have like a weakened immune system and you're on chemotherapy treatment for cancer or having long-term steroid medication. That's all about vaginal thrush. I have tried to cover everything in the simplest way possible. So do like, share, and subscribe my channel. Follow my Facebook page, follow me on Twitter, follow me on Instagram.